In this video, we're talking about skin symptoms. Dr. Petersons, I don't know about you, but one of the things that comes up so regularly is keratosis pilaris, or that chicken skin. We just need to say that up front. That's actually not very helpful. What is helpful is understanding what, one, pictures can be really helpful with skin symptoms, just like with movement symptoms. And two, diagnosis for skin symptoms is super, super helpful because that is one area within the materia medica and the literature that we have that a specific diagnosis can give us a lot more direction for an appropriate remedy versus some of the other things that we aren't concerned as much about diagnosis. So let's talk a little bit about that and how to give us some descriptions if you haven't gotten a diagnosis yet related to skin pathology.
Yeah, so if we can't get a picture and we don't have a diagnosis, the next best thing is our observation skills. Psoriasis tends to be that flaky skin condition where it flakes off and there can be blood underneath when you scratch it. Eczema, again, often very confused with keratosis pilaris. So good to describe it and where it's located. Keratosis pilaris, backs of the arms, very common, sometimes on the cheeks, on the shins, but eczema can be anywhere on the body. Knowing where it is, if it's itchy, what makes it a little bit better or worse. Warts, where those are they on the hands? Are they on the feet? Are they on the elbows? Are they big? Are they small? Do they ooze? Do they bleed? Again, do they itch? Impetigo, again, another one that we struggle with. What does it look like? Is it honey crusted yellow, or is it, red and bloody? Is it scabby? Those types of things. Again, why a picture is so worth 1,000 words when we're talking about skin conditions. And then, of course, wherever it's located on the body is very useful.
Yeah. So one thing that we always talk about is suppression of symptoms. And this is a particular area where it comes up frequently for us. So it is important, even if it is not a current symptom, that you tell us about past skin symptoms, especially if you've used something like a steroid cream to suppress it. So obviously it's a little bit harder to describe a symptom that has been gone for several years, but the best that you can describe symptoms of past skin symptoms can be really helpful in giving us some indication, because just because it's gone, if it's been used or treated with a suppressive treatment, it doesn't actually mean it's necessarily been healed. And so it's still part of the picture for your kiddo. So that's really a very useful past symptom to bring up.
And if something followed it, you use the steroids and then we saw asthma, or we saw tics, or we started seeing seizures, knowing that that's part of the start of the disease state can be useful.
Yeah. And as we said, sensations are always useful. It's not always itchy, right? You might have stinging, you might have burning, you might have all sorts of different types of sensations with the skin symptoms. Changes in color aside from the face are really useful too. Knowing any impacts of temperature, so temperature applications or just exposure to temperature, cold drafts, hot air, muggy air, high moisture content air, that all can make a difference for how the symptoms are presenting and which remedies are going to be most effective in that particular presentation. We can also talk about things like slow wound healing and cradle cap or dandruff. So again, where it's located, what the flakes look like, is there bleeding associated with it, what's the sensation associated with it, and all of that. Last thing that I want to say before we move on to hair and nails, and I'll let you tackle that, Dr. Petersons, is that acne is actually not very helpful, even though it is something that especially the older kids can be hyper focused on. It's generally not very helpful as far as finding a remedy. You can share it with us, but it's not the most helpful. And honestly, it's not even the most helpful for helping us see how somebody is progressing, especially for a teen or tween. So you can bring it up, but we may not pay a whole lot of attention to it because it's generally not as useful for a symptom, either for tracking progress or for selecting a remedy. So let's move on to hair and nails because that's associated with skin too.
Yeah. So our hair, some of these kids will have hair loss. So knowing how the hair is coming out, is it in chunks or is it in, lots of strands, and then where on the head, if there's any like bald spots is useful, if the hair is, easily breakable, those kinds of things. And then the nails, if there's any changes in the nails. So if there's white spots or there's ridges or they're coming off the nail bed or there's, prone to infection around the nails or
The nails are
those type.
peeling or becoming really weak or very brittle. Those are also useful.